Welcome everyone to our webinar today, Parenting During Periods of Uncertainty and Unrest. We're so excited to have over 1,900 people registered to participate with us today. So we encourage you to get involved, to answer questions or ask questions in the Q&A feature on your Zoom screen, to use our hashtags holding space for BMOC. You can see it on the screen here. It uses the number 4 and the letters BMOC, and equity flattens the curve are 2 hashtags. So we encourage you to engage on social media and on Twitter to reflect, tweet, and post your thoughts about today's webinar. We're grateful to all of our sponsors, partners in helping us present this webinar to you today. And we encourage you to also connect with us on Facebook Live, and if you're in order to be able to ask questions and have more interaction. For today, if you're in the webinar, you can use the Q&A in Zoom. Please put your questions there. That's where we'll be able to track them best, not in the chat feature. So again, please use the Q&A feature rather than the chat feature. We may not be able to answer all of the questions today, but we will be able to include a full recording that will go out to everyone who's registered, and we will try to answer all the questions afterwards when we do that. Our host today is Dr. Wisdom Powell, and Dr. Powell and Division 51 recognizes that psychologists have a critical role to play in advancing social justice and health equity for boys and men of color. Advancing health equity among boys and men of color entails reimagining masculinities, bridging long-standing empathy gaps, and transforming systems so that when they are built, boys and men of color will come. Dr. Powell is our host today, is the Director of Health Disparities Institute and Associate Professor of Psychiatry at UConn Health. She serves as the President of the American Psychological Association's Division 51 Men and Masculinities, and is an Honorary Professor of the University of KwaZulu-Natal in Durban, South Africa. Formerly, Dr. Powell was Associate Professor at Health Behavior at UNC Chapel Hill's Gilling School of Global Public Health and Research Associate Professor in UNC's Department of Social Medicine. Dr. Powell also served as Associate Director of the Center for Health Equity Research, faculty member at UNC's Lindbergh Comprehensive Cancer Center, and Director of the UNC's Men's Health Research Lab. In 2011 and 2012, she was appointed by President Obama to serve as a White House Fellow to Secretary of Defense Leon Panetta, and in this role, she provided subject matter expertise on military mental health for topics like PTSD, suicide, and military sexual trauma. Her community-based research focuses on the role of modern racism and gender norms on African-American male health outcomes and healthcare inequities. She has published numerous peer-reviewed articles and book chapters, including one in the American Journal of Public Health, Journal of General Internal Medicine, Behavioral Medicine, and Child Development. In addition to being a White House Fellow, she is an American Psychological Association Minority, Robert Wood Johnson Foundation, Kaiser Permanente Birch, Institute of African American Research, and Ford Foundation Fellow, who received a PhD and an MS in clinical psychology and an MPH from the University of Michigan, Ann Arbor. She serves as chair of the APA's work group on health disparities in boys and men and co-chair of the Health Committee for President Obama's My Brother's Keeper initiative in Durham County. In recognition of her public service to boys and men, she received the American Psychological Association's Distinguished Professional Service Award, and in 2015, she received the prestigious Philip and Ruth Hedelman Prize for Outstanding Artistic and Scholarly Achievement by Young Faculty. Dr. Powell was awarded a 2017 academic writing residency at the Bellagio Center for the Rockefeller Foundation. During this highly competitive residency, Dr. Powell will work with other global leaders on strategies for transforming social and healthcare system and landscapes to address gendered health inequities among vulnerable males. And most recently, she was selected as the Health Innovator Fellow by the Aspen Institute. And we are so pleased to have Dr. Wisdom Powell here today to host this webinar.
Thank you so much, Lauren, for that introduction, and to all of you for joining us today. I'm going to share my screen now and sort of give you a brief introduction of our conversation today, or at least the one we anticipate having, and invite you to listen, intently and to ask your questions when we get to that point of the conversation. So thank you again, everyone, for being here. We look forward to a really robust discussion this afternoon. Before we begin, I think it would be important for me to offer some special thanks to folks who are collaborating with us on today's conversation. The first thanks goes to the Equity Flattens the Curve initiative that is being led by Dr. Brian Smedley and others at APA. I also like to thank our collaborators at Division 43 and 35, our Division 51 COVID-19 Task Force, the Yukon Health Disparities Institute, and the Office of Children, Youth, and Families at the APA. Thank you all for supporting this conversation. This conversation comes as a part of a series that we are launching within the division and also with partners across APA. And our first webinar focused on Beneath the Masks, Men, Masculinities, and COVID-19. We've also developed a fact sheet that you see on your screen. And so if you have an interest in receiving this fact sheet that provides useful information, also resources, please reach out to our division and we will provide that contact information at the end of today's webinar. But to launch us in today's conversation, we are so pleased to have an illustrious panel of guests, including Dr. Dan Singley, who's a San Diego-based board certified psychologist and director of the Center for Men's Excellence and also a member of Division 51. He is a past president of the APA section on positive psychology, and he serves on the board for Division 51 Society for the Psychological Study of Men and Masculinities, as well as the Postpartum Support International. He conducts numerous trainings and makes significant contributions to the health and well-being of new dads and other fathers as they work to hold space for their children. I'd like to also welcome Mr. Anthony Gay, who's currently employed by the Connecticut Department of Children and Families and has been a supervisor for that agency for the past 14 years. He has done a lot of work in the areas of helping fathers engage their children with more thoughtfulness and continuity, on cultural competency, and on domestic minor sex trafficking. He has been a voice for equality at the DCF for the past 10 years and serves as the Region 5 Fatherhood Engagement Leadership Team Lead. I'd also like to welcome my colleague and longtime friend and collaborator, Dr. Shauna Cooper, who's an associate professor in the Department of Psychology and Neuroscience and director of the Strengths, Assets, and Resilience Lab, or the STAR Lab, at UNC Chapel Hill, and is currently an RTI, or Research Triangle International University Scholar at the Center on Social Determinants, Risk Behaviors, and Prevention Science. Dr. Cooper has published numerous publications in the areas of father-child relationships and explores questions like how race experiences affect well-being and health, the cultural context of parenting, and community-level risk and protective factors. She's been awarded a number of prestigious honors, including that from the National Science Foundation. Also, would like to welcome Dr. Chuck Hollister, who's a licensed psychologist in private practice and CEO of the Missouri Psychological Association. He has built a strong relationship with Missouri's regulatory agencies, which leads decisions about the state's Medicaid program, especially the program as it relates to funding psychology interns. Dr. Wendy Williams is the president of the APA's Division 35, the Psychology of Women, and the professor and dean of the School of Education. I believe at, I think Mills College is the place where she serves, but she works on the development, implementation, and evaluation of school and community-based health and educational interventions. She is doing profoundly important work on relational aggression among Black women in academia, and also working to advance scholarship that creates a better trajectory and well-being for Black girls and women. This is all of the contact information for the panelists that are participating in this panel discussion today. We invite you especially to connect with folks on social media. So I have their social media handles lifted up here, and Mr. Gay can be reached by email at the email address listed on this slide. We will provide this detail at the end of our conversation, but I'm putting it here in case you have the desire to tweet something that you heard that spoke to you or that you think you want to share with others in social media. So please feel free to use these handles throughout today's conversation. So let's get right into what we're here to discuss. I'm going to just lay out the foundation for our conversation, and then we're going to move right to our speakers who will each provide some context and insights on issues facing parenting during periods of uncertainty and unrest. And then we'll move to a Q&A where we'll take some of your questions and hopefully launch into a collaborative discussion. To start us off, I just want to talk a little bit about what I think parents need to know about racial trauma and radical healing during uncertain times. Certainly, we all recognize that COVID-19 has significantly altered our social and healthcare landscapes, such that we're seeing disproportionate risks of COVID-19 related disparities in Black, Indigenous, and people of color. We know that there are higher death rates, that BIPOC individuals are more likely to live in viral hotspots and have higher rates of employment loss and a higher number of essential workers. We know that COVID-19, is elevating adverse mental health conditions among US adults, but also disrupting academic achievement and learning opportunities for the millions of students who are missing classes now because of the COVID-19 pandemic. It's important to recognize also that while sheltering in place during this pandemic, our children are also bearing witness virtually to upticks in racialized violence, which has significant implications for their socio-emotional competence, creating what we're calling a syndemic, where we see the dueling pandemics of COVID-19 and racism altering people's well-being and outcomes. Some have described the COVID-19 pandemic as a trauma pandemic in the making. So the question for us today is, how are the children? Let me tell you how I think they are based on data that we have seen emerge, not just during the pandemic, but before the pandemic actually started. We were already bearing witness before the pandemic started to upticks in suicide among Black children. To make this plain, we have lost children like Gabriel, Rylan, Nigel, and Mackenzie, all children who were standing at the proverbial ledge, waiting and hoping that adults would rise up to meet them at their highest intentions for healing. We know that racism is persistent in our nation. We don't need to have a conversation, I hope, about the fact that we're not quite post-racial, and the implications of this persistence of racism are quite pronounced for our children, limiting opportunities for upward social mobility, also impacting and increasing risk for trauma. The American Psychological Association recently produced a profoundly important special issue documenting all the ways that racism can produce trauma symptoms and responses, including thinking about the ways that racial trauma can impact learning and academic performance. We also know that there are gender differences in trauma response, and that's why I'm so excited to have scholars on this panel who can talk about the differential ways that these issues may show up for children who are male and female. We know that women and girls embrace trauma in very different ways and often are impacted by Superwoman schemas that require them to project strength, suppress emotion, to show up in spaces and take care of the world, even while they're trying to care for themselves. Important things to think about when we try to mount responses or strategies to address these in our children. We also know boys are receiving a lot of messages about how they should shoulder on, muster up immense strength and displays of invulnerability in the face of insurmountable traumas. There are also significant systems level gaps in our capacity to listen and respond to the distress signals that our children receive or send us, because largely we're adultifying them. We're assuming that they are more adult-like and less innocent in some cases, especially we see this occurring among Black women and girls. We see this happening for Black boys too, in ways that suggest that we see them as adults even when they are children. This has implications for how we respond now during the pandemic and afterwards. It is creating a case for and a need for radical healing. Now, radical healing has been described and discussed by many scholars in the fields of medicine and psychology, but the case I'm going to make today, as we discuss how we're going to rise up and meet our children at their highest levels of intention for healing, is how do we develop systems that move beyond simply helping our children cope with some of the issues they're facing towards ones that might help our children to heal, grow, and thrive. And it's with those introductory remarks that I invite our first speaker to come forward and to share with us some of their scholarship, practice, policy-related work that is directed towards helping parents during this time deal with some of the issues I've lifted up and some that they'll tell you about in their presentations. Thank you so much for listening. We look forward to hearing from this illustrious panel of scholars. And at this time, I would like to invite Dr. Chuck Hollister to give the opening presentation. Thank you.
Thank you. Somebody want to put my slides on the screen real quick? You know, I spent a lot of time the last few days simply talking to, next slide, please, talking to parents. During my career, I've spent it working in kind of high-end situations. I've worked with, during my career, 25,000 plus children, most of which have been seen as being a danger to self or others. And so chatting with everybody the last few days, I think what I'm going to tell you is what we know. This is not a normal world, and it's not a normal time. I can remember when my older son came to me and he said, Dad, this is, it'll be a few weeks before we're able to talk and visit and have dinner together. That was in March, and we haven't had dinner together because he wasn't able really to take it in. How serious things had changed, how COVID had just permeated everything in our life. So as I was out talking to folks, people said to me, everything seems to take 4 or 5 more steps than it did before. One of our local schools had 80 high school football players placed into quarantine. What if your son's one of them? What do you do when he comes out of quarantine? Does he get to play football? You've got to decide. Do I send my child to school or do I keep her home? What's the right thing to do? Because I want to do right by my kids. One family I talked to had a 5-year-old daughter, and she came up and she said, Daddy, I want a friend. And yet she's in quarantine. What do you do about that? How do you make that work? How do you not feel guilty about that? Several parents talked to me about how their go-to support has evaporated. Many people got their support at work, being around folks, but now they're not around folks anymore. They're quarantined. A lot of folks used to have friends over or family over, and they can't do that today. So again, they're isolated. They don't have that kind of natural support that we always have had. One person commented to me that our natural rituals have just dissolved. Just simple celebrations that we've had are more and more difficult and stranger than they've been before. Virtual birthday parties instead of the kind of exciting, crazy birthday party where you run around the house and make a lot of noise and have fun with all of your friends. I think one of the stories that was most true was somebody who said to me, we don't even know when we're upset. They talked about how that they had this really heated argument about the dog getting onto their couch. And while it was all escalating, suddenly it occurred to them, wait a minute, this isn't normal for us. And they realized they were just simply overwhelmed as a family. Next slide. So a lot of folks are just not sure about how to protect their families and give them that normal growing up that they want. A lot of them are struggling with apathy and procrastination. Depression is at an all-time high in our country. It's about 3 times higher than normal right now. They find themselves thinking, I don't care anymore. They find themselves putting things off and not even noticing that they're doing it. For none of the folks I talk to describe this problem, but I think we all know that it's there. We cope with those, whatever we used in the past to cope with, we do it more intensely now. And if you were somebody who turned to drinking, that becomes a real problem in this day and age. One of the other problems we have is just simply the health disparities and economic disparities that go on. In one of our metro areas, one of the poor areas of town is where we had the largest outbreak of COVID. Where was our largest testing centers? In the more affluent areas. And these are just kind of the realities that we're facing every day. It's not a normal world and it's not a normal time, and we're not quite sure when it's going to change. And so anyway, next slide, please. So what I've put up here, and you'll be able to look at this later on, is simply think of a list of some of the solutions that you might use just simply to get through the moment, ways that you can improve your coping. And so I would invite everybody, just even in this moment, to take a simple breath and to practice breathing on a regular basis. It's one of the most important things you can do. And be sure to reach out to all those people who love and care about you so that they can be part of your support system. And go very, very easy on yourself at this particular time and place, because it's hard. It's hard for every one of us. And if you feel like you can't handle it anymore, go get some therapy, because one of the most wonderful things that has happened in recent months is that we've really opened up the telehealth field. One of the things that I got to do that I was really, really happy about was we had a lot of folks in our St. Louis area in Missouri getting their medical care there from Illinois. And after COVID hit, they couldn't travel to St. Louis to get help, and yet our licensure laws wouldn't allow our therapists in Missouri to provide care. And so I was one of the people who worked with the licensure boards in Illinois to open that up, and we were able to get about 3,000 patients help because of that. So take advantage of that. Take advantage of that. So anyway, I want to thank everybody. As we get in our question and answer, we'll probably come up with lots of solutions for what's going on. But, you know, the fact that you've all reached out for help, that you're here today, I'd say that you're likely to be very successful in coping with what's going on.
Thank you so much, Dr. Hollister, for those remarks and for reminding our audience about the practical ways, the solutions that they can mount in this moment. So critically important. I'd like to now invite Dr. Wendy Williams to give her remarks and her presentation. Thank you for joining us, Dr. Williams.
I'm glad to be here. I'm just going to get my screen shared so that we can get going. I want to say, just as we're getting started and as I'm transitioning, that, you know, I really took to heart the opportunity and the importance of being able to speak directly to parents. And to acknowledge that while there may be a good number of psychologists on this call, excuse me, I'm sorry, I'm having trouble sharing. Yikes. Well, I think this is probably that instance that we thought could be an, oh. Oh my God, it just froze.
No worries. Why don't we, from our side, show your slides, and then we can just give us the signal when you want us to move forward.
Okay. Well, this will be fun to do. My screen, everything has frozen on my end, so I wonder if I should dial out and call back in, or if we should just move forward for time's sake. But I'm happy to just continue forward. I won't know necessarily which slide you're on.
That's okay. Why don't we do this? We'll give you a moment. We are all in a virtual world, and we understand how technical difficulties are part of the new reality. Okay. Why don't we give you a moment to reset? And why don't we ask Dr. Singley to go next?
Thank you.
No problem. And while Dr. Singley is coming forward with his presentation, I still want to remind people to continue to put your questions in the Q&A box, and we will answer those questions in real time if we can. If not, we will be returning to them at the end of our presentation. Thank you. Dr. Singley.
Thank you. First, are you all looking at my PowerPoint presentation, or an odd mishmash of windows?
I'm actually not seeing your slides yet. I see Dr. Williams's notation on the screen, but if others can see them, it might just be me. Oh, I can see. Okay, audiences are saying they see the PowerPoint. Thank you all for letting us know. Okay.
Yeah, thank you. As I say, tech issues are the new traffic, and I'm no exception. Let me just say, I'm thrilled to be able to take part in this presentation. It's so important and so needed, and I'm humbled. So I'm Dan Singley. I am a psychologist in San Diego. I do serve on the board of directors of the American Psychological Association's Division 51, the Society for the Psychological Study of Men and Masculinity, of which Dr. Powell is, of course, our president right now. And her presidential initiative of holding space for boys and men of color it could not be more timely. I was reflecting as preparing for this that that many of the Black and brown men that have been hurt and killed in racist incidents that are getting a lot more attention these days, a lot of them are dads. And some of them are fathers of infants and toddlers. And that's relevant here because that's very much what my focus is. So I focus on parenting, but in particular, I focus on early fatherhood, psychosocial transition, what I call the, from dude to dad. And so I sort of see fatherhood, and in the parenting, I particularly in the early parenting process, I'm very, very focused on looking at these dads. In fact, when I saw the title of this, parenting during periods of uncertainty and unrest, I was like, yep, that's pretty much the period around the birth. So of course, it's gotten heightened with COVID and illustrating more about racism and racial justice. So one point that I wanted to quickly cover, I'm not going to do an academic talk here so much, but I did want to talk quickly about the role of implicit bias, which has gotten a lot more coverage lately, as well as what my colleague in Division 51, Joel Wong, calls prototypicality. And the idea is stereotypes, basically, like ways that we cut mental corners and try to make sense of the world, sometimes without even being aware. And this is directly relevant here in that oftentimes when we think about the parenting of infants and young babies, we're thinking about the gestational parent, typically female identified persons, moms, right? And usually, of course, like other aspects of masculinities, it's under construction and getting better, but oftentimes we sort of think of as the fathers as in the background, and in that way tend to be less likely to focus on the fathers in the perinatal period spanning, conception, birth, conception, pregnancy, birth, and the postpartum. Now, of course, these ideas of implicit bias and prototypical ways that we think about different intersections of someone as a cultural being, their gender, their ethnicity, their physical ability, and so forth, draw to bear on how we think of men of color and how we think of them differently. And so in the sense you might think of an stereotypically, prototypically sort of hyper masculinity, hyper prototypical men of color, more aggressive, more intense. Hypo would be less so. And when we start to combine these and really think in an intersectional framework that looks at, okay, parental status, masculinity, where's the person in terms of the access to resources and financial stability or instability, start to see ways that we can simply not be focusing on the dads or what's important to them. And this is especially tricky because the current generation of dads there are all kinds of different ways that we could say yeah, but, or exception. Generally speaking, certainly in the United States, fathers are now expected to be much more involved than they ever have before, but the models aren't there so much. Like if you look on, on television or in the movies or on social media, for fathers of babies and infants, you still see the so-called bumbling dad or the absent dad. And that's one of those tropes, and the research is not really bearing that out as much, that dads of color are absent or not present. They may not be, in some cases, cohabitating, but the desire to be involved is there. And the fatherhood generation gap points to, we don't have as many models for the dads that are trying to do the right thing and be involved even right from the get-go. Quick plug to be aware, because I work with lots of expecting new fathers that have experienced loss, miscarriage, stillbirth, and so forth. And 1 in 10 dads gets postpartum depression. Between 4 and 16% develop anxiety disorders. And these prevalence numbers go significantly up when we start looking at fathers of color. One of the dynamics at play here that is, of course, disproportionately affecting folks that are in different hospital or birthing center situations is for the birth, some hospitals or centers are not allowing dads to be present, the non-gestational partner to be there present around the birth, which itself can be very, very difficult for everybody involved. And sometimes, certainly if they have other children, the ability to be present for a birth while still trying to care for existing children can reflect a mountain too high. And directly relevant here to fathers of color, I see over and over and over again, not just traumas from family of origin, but as Dr. Powell made reference to, these generational traumas, historical traumas, and a way that I see this play out clinically over and over and over again is fathers from, say, Native American fathers or Latino dads or African American dads who themselves have experienced racial aggression, microaggression. They've talked to their parents about it. They know about belonging to a group that has been oppressed and has been marginalized, with the awareness that I'm a man being taught to protect and provide and be that crazy dude and powerful and all that. And I'm about to bring a life into this world and I can't protect them from that. And so this historical trauma piece is one that a lot of times the dads I'm working with, they may not have the words for it. They don't quite know how to describe it, but it's so salient. And feeling neglected, feeling pulled out of the process at a time when society is telling them that they want to be more involved. I have experienced this as a key aspect of some of the traumas that they're experiencing. Really quickly, my team has an ongoing research project looking at fathers' involvement with their infants, and we recently completed a study looking at Latino dads here. I'm in San Diego, I'm bilingual, I work with Latino dads a lot. And one of the findings that we had is that for these dads, experiencing higher levels of frustration, which most of us, but certainly folks here who may be experiencing higher levels of awareness of racism, disempowerment in the form of access to resources, limited mobility and freedom, high levels of frustration and these lower levels of partner support and distress were actually predictive of a different kind of father involvement. So it's not just we're all stressed and these Latino dads are like checked out on their kids, but providing a kind of involvement, indirect care, taking them to daycare, taking them to the neighbors, taking them to the park, helping to arrange for medical care to the extent that they can. So that flies in the face of that these Latino dads are checked out and not doing so well. Last thing I want to say is I've had the privilege to be able to see different organizations. Now I do a good amount of consulting around organizations that want to involve fathers and Black and brown dads that are starting to look at how can we really see the vulnerabilities, the needs of the people that we're working with. And so for those folks who do that kind of consultative work with organizations, helping the constituents, the people that they serve, to really feel seen and to have a voice in what you offer, super, super important. Also, I work with a number of immigrant dads, and not just Latino immigrant dads, but of South Asian descent, certainly from Latin America as well, who have been here and have a sense of being othered. I don't fit in. People look at me, they think I'm ugly, they don't like. Lots of thoughts along these lines, some of which are based in very understandable experiences they've had. Well, seeing some of these dads go out and take part in social media campaigns and feeling the support, going out physically into the streets and taking part in protests and seeing all the support for African Americans, for people of color, that there is a real intolerance for this. I've been privileged to have a number of conversations with friends as well as patients of mine that said, for the first time, I really feel that support. I really see it. I saw the person, I had the conversation. And so I'm certainly not trying to downplay it, but I am looking at one thread that's running through this experience that's helping these Black and brown dads to have a sense of comfort and confidence as they move ahead. So I'll pass the baton here.
Thank you so much, Dr. Singler. You've given us so much to think about, and we're so excited about all the ways that you're serving fathers and their children as boots on the ground. We often don't talk a lot about how important it is to have that presence, and we're especially just grateful for all that you're doing. We're also happy to have Dr. Williams back, and I know as someone who has experienced those kind of technical difficulties during the middle of a presentation, it is not pleasant. But we understand, and we're so thrilled you're back. And if you're ready, we would welcome you to give your presentation at this time.
Wonderful. Thank you so much.
Thank you. No worries.
It is not pleasant. One of the things that I was thinking as I was getting started with you all is to really speak to the importance and how grateful I am to be able to speak to parents and to talk directly and to sort of merge the educational spaces alongside our psychology field. I subtitled the work that I would present today and talk about being the precarity and preciousness of parenting Black children, as I was asked to think about girls, but I think about girls and boys all the time and what the experience is for Black parents to be supporting them. We've gone through and talked about the context. I won't spend a lot of time there, but what I will spend time is right here in the center, where we think about what it means to take an intersectional feminist lens toward the particular experiences of parents and parenting. And I think it's spot on that I came right after Dr. Singley, because there is something very important for us to sit with in terms of the Black life, the brown life, the indigenous life that parents feel charged to protect, and also at the same time feel nervous or unsure of whether or not they actually can protect and hold the vulnerability of their children and their children's lives in the context of what it has become very clear in a racist, anti-Black and white supremacist society, and what that means for rearing young ones who are coming up. But also thinking about parents and caregivers across the board, kinship relationships, aunties and uncles, as well as mom and dads that are raising young people who are middle-class families who are specifically hurt by the financial reliance on our service economies, and yet not the appreciation for them. And so we're thinking about teachers and school leaders and clinicians, but we're also thinking about our grocery store clerks, gas station attendants, and Lyft drivers and Grubhub folks who have been delivering and running this economy and keeping us going, even though we've been in the middle of a pandemic, and the disproportionate health burden that they've taken. And so there are these interdependent risks CDC put out, just sort of a linking of the discrimination, health access and utilization, occupation, education, income, and wealth gaps, as well as housing gaps. I'm in the Northern California Bay Area, and I know that many of you all know across the country that this area has struggled tremendously with housing insecurity. And so, when we think about this ocean of like who is essential, and what does it mean to be essential, and what does it not mean to be deemed essential, sometimes that word around the work that folks do feels sort of contradictory to me, and how that sits alongside the reality of lives mattering and who matters. And so when we're thinking about children and the intersection of their psychological health and well-being and that of parents, which is entirely important for children, that mom and dad and grandma and grandpa and auntie and whoever is in their ecosystem caring for them right now, that they are mentally healthy and well, predicates the health and wellness of that child. And that's one of the things that we are coming to learn and know right now. I want to really speak to, as a dean of a school of education and one who prepares teachers and the teacher leaders and educational leaders, to think about what it's meant for our kids to be at home, what it's meant for our children to be at home for now over 6 months, and for parents and caregivers to have taken the primary responsibility for providing care and supporting the educational engagement of their young learners when they can. So, it's parent, it's teacher, it's also breadwinner. And again, depending on where members of our society and our community fall within our trajectories and our continuums in terms of wealth and access and ability, we see different outcomes for different kids and different families. I want to speak specifically to this experience of homeschooling and how actually we as the adults are getting schooled on how to do this, and actually getting and learning a huge lesson of what it has meant to be a teacher in this country. I know that you've seen the news just as I have over the last 5 to 10 years of teacher strikes and all the rest. And I think one of the things that we've come to appreciate, especially as our children have returned home and are relying on us to facilitate their learning, despite them being tuned into a Zoom or being too young to be tuned into a Zoom, or not being able to attend to that because, you know what, they're 5 and that doesn't really fit for them, or they're 16 and that doesn't really fit for them. And so things that parents have been able to learn about their children as learners, learn about schools and how schools are working and don't work for their kids, and also to learn about their child's teacher have been quite important. One of the things that I see has happened for many parents is that what parents have known about who their children are has now, because of this pandemic, recentered a focus on valuing what they know. It's no longer okay or permissible to rely only on what teachers and educators share. And also that parents have to figure out, okay, who do I know my child to be, especially as they're home, to support them working on this assignment or getting a better understanding of this new concept that they're attempting to learn in these strange circumstances, and circumstances that are strange for me as well. And I think that this is a very important thing. It's been highly stressful, don't get me wrong, but it's also been, I think, an important moment for parents to reclaim their authority and their role in the learning of their children. And so while bringing schooling into the home via digital spaces as we are using today has increased the surveillance within homes of students, and I would say sometimes to a negative effect, right? We've been able to sort of take a deficit-minded approach to thinking about how certain homes are operating, whether or not we're requiring young people to turn on their screens or their cameras or not. And also really what we're seeing is sometimes how poverty manifests to create instability and dysfunction that is challenging for young people and families, and the ways that schools have been respites. We are also seeing the ways that parents are allowed to see what their children are subjected to, good or bad, within a school context. And again, bringing in what they know and have learned about who their child is to make sense of that. I don't know if you all have seen this. I am a Twitterer, and so I do follow some of these stories. It helps to keep me current. And most recently was a mother who watched a teacher speak negatively, I would say, about George Floyd. Her child, I don't know their racial background, but they appear to be of non-white descent, of color. And essentially what the teacher had said was that George Floyd should not have been honored. And so the class was having a conversation about that. And this mom, these are just quotes of what she said to this teacher. But what she did was interrupt that class space. He wasn't, asking, are you saying he wasn't supposed to be honored? Are you saying this because you're white? You're talking about this to my kid. This feels like an ignorant and disrespectful conversation. And ultimately, the choice that she made, that I've interrupted because this is Zoom, right? And this is streaming into my home and I have a right, and I'm seeing this. I'm assuming she's just probably walking by a room or through the kitchen, wherever the kids are located doing their work, and heard this happening. And the one thing that I thought about this is that, there are so many instances where young people are in school and educational spaces where parents don't see what's happened, and where kids may or may not have the language or a way of processing and articulating what they've experienced. But this mom was there. And I think about then what that added burden is for parents of young people, particularly of Black, Indigenous, and people of color, raising their children within an anti-Blackness, white supremacist society and cultural context, and the additional lens and lessons that they are engaging. This is a music video. I happen to love Janelle Monáe, and so she has a new video that was out. And one thing that struck me was that she did a twist on the doll study that we know so very well, wherein this child, instead of choosing the white doll, chooses the Black doll. And I want to underscore what that means in terms of parents having active space in place to be engaged in the educational context of their young people, because that is an ultimate lesson that that they have, and an ultimate responsibility that they have in their parenting. I'll add and just say here that it's time now for a new, or I would say a rather remembered advocacy of our educational spaces for our young people. And when I think about what we would offer and add to parents, it's nothing new. It is certainly owning and taking full authority and authorization around what you know about who your child is and what you're learning about them as a learner as they're home with you. And really thinking about what that means. We've all been talking about getting back to normal. I don't know if that's necessarily where we want to get back to, given what we know about how our systems have functioned and worked with disparate and disproportionate burden, educationally, health-wise, criminal injustice as well. But thinking about what they've always learned or been learning and hearing about who their child is through parent-teacher conferences and all the rest, and what they're learning and knowing, become really important advocacy tools for them to then take into conversations moving forward on behalf and with teachers to support and, I would say, conspire with educators toward their child's excellence. And so there are just a few things that I think, again, they're not brand new ideas, but I would like to, articulate maybe a reinforcement of, number one, talk to your child. Even when you think that they don't have the words to explain what has happened or what they're thinking about is going on, who they understand themselves to be as a learner, as a thinker, in a classroom space, in the classroom and learning community in relation to their teacher is incredibly important for how they then sit in a classroom or in an educational space and prepare to learn. And also not to be afraid to talk to their teachers. Now, I know that this one parent on Twitter, that was an extreme example. And I do think sometimes that extreme examples are important to underscore, us taking our roles and to engage. But more than anything, that there is an incredibly important partnership between parents and teachers that I think has been relied upon more heavily during the time of the pandemic, as teachers have had to rely on parents to facilitate learning at home, and parents have had to rely on teachers to understand what it is that they're trying to convey and teach in these spaces. I also want to underscore the importance of exploring options beyond the classroom or the school where your children are. There are many options. There, our digital landscape and our technologies, as well as the many public, private, charter, educational contexts and experiences that are available, create opportunities for us to examine and explore where would my child, with who they are as a thinker, learner, and human, do well? Where will they prosper? And finally, to explore supplemental educational experiences that validate who they are as a learner, thinker, and human. Again, because we're doing two things, particularly with Black, Brown, Indigenous, and students of color, in that we're not only trying to teach their reading and their writing and their arithmetic, but they're also trying to teach them how to read the world and how to help them teach the world how to engage them. And that's a really important and critical lesson that just simply is not one that we're often given credit for, the work that parents of Black and Brown and Indigenous kids are doing. So I'm gonna discontinue sharing and pass on to the next.
Thank you so much, Dr. Williams. You've given us so much to think about, but the thing that sticks out for me of the many brilliant things you shared is this need for remembered advocacy. I often talk about the fact that racial unrest and COVID-19 have really torn apart so much of our communities, of our children's sort of normal day-to-day environment, and we need to put back together that which it has torn apart, meaning to remember. So that just really stood out to me. I just want to thank you for that. And with those remarks, I want to bring forward Dr. Shauna Cooper, who will speak to us next. Thank you.
Okay, I think everyone can see my screen.
Yes, we can.
Okay, so I really, I think the previous talks were a great segue and a really, really nice foundation for what I will talk about and share with you today. And so briefly, when I think about my work as a developmental psychologist, not just as a researcher or scholar, but thinking about translation of that work, I find it important to really situate understanding families and children within the broader social context. And I think all of the presentations before me have provided a really rich discussion, not just tools and strategies for parents, but also understanding what this means within the broader social context, in the context of COVID-19, but also in the context of pre-COVID-19 and what this means post-COVID-19. So with that said, I wanted to provide a quick foundation around sort of description of key points for my talk. And so some of these will move to our Q&A, but I wanted to first talk about COVID-19 work context, both within the context of what parents are experiencing now, but also thinking about this as an extension of continuing inequities. And much of my work has focused on Black families, specifically Black fathers. I will talk about some of the compounding and cascading effects, but keep in mind that many of these issues intersect with many other families of color. And so as we move toward our Q&A, I think it's important to think about things that are distinct, but also areas of overlap in terms of broader work context and how that is really impacting families. Also, I will talk about how Black families and other families of color have been navigating dual pandemics. So some of the other talks have talked about this balance of, as we have experienced an ongoing pandemic, how Black families, how fathers have made sense of continuing acts of racism and discrimination. And then leaving you with ways that we can better strategies for supporting parents during the pandemic, but also how we can help parents better support their children, not just amidst COVID-19, but also beyond. So quickly, I wanted to situate my discussion within the current here and now vortex. And some of these percentages vary across the source, but they're roughly in the same ballpark. And so what we know is that 40% of parents, both mothers and fathers, are able to work from home. We know that African Americans and Latinx workers are less likely to be able to work from home. And we also know that they are disproportionately represented in essential and frontline occupations. And so what we're seeing here is that these statistics are in the moment of what's happening in the face of COVID-19, but they also reflect structural inequities and in indirect and direct ways have intergenerational impacts. So this is some of the data that we collected in our lab with Black fathers. This is a national sample of Black fathers, almost 500 Black fathers collected in June or July, which represented a period of increased COVID-19 cases across the country. And so this is just some of the descriptive data to help anchor the discussion. But what we found and are continuing to find is that almost 50% of our fathers reported working or being essential or frontline workers. 31% reported working in contexts that were high risk for contracting COVID-19. Almost 30% lived with someone who also worked in a high risk context for contracting 19. Almost 30% of our fathers reported some income loss, personal or in relation to the broader household. And so again, I wanted to show, as we talk about inequity, some of the data that we've collected as the COVID-19 pandemic has unfolded in terms of what are some of the impacts on Black fathers, but also extending to families. And so I will quickly sort of talk about this in the context of what I call both compounding and cascading effects. And so work contexts in the literature, what we're also finding in some of our own work is that these work contexts have been related to increased health risk, whether that is physical health risk or increased mental health risk, as well as economic challenges. And so we see that some of the inequities that have existed before COVID-19 have intensified. And quickly, when we asked our fathers regarding to report on their COVID-19 diagnosis status, 34% of fathers in our sample, and again, thinking about this in June and July, reported a personal COVID-19 diagnosis, and 21% reported that a close relative, so close relative being their child, their partner, or their parent, had been diagnosed. And so again, thinking about these work contexts and work characteristics and what they mean for Black families, but also extending it generally to families who have been in the workforce as COVID-19 has continued to unfold. And so again, thinking about this, I know the larger literature talks about this as spillover, but we are truthfully in a moment of cascade. So I think, given what we know in terms of how some of these are having impacts on the work life of parents. And so thinking about that with respect to increased stress, increased role strain, I think, very vividly about some of the first faces that we saw in the media who were victims of COVID-19 were African-American men and women, as well as other men and women of color. And many of them were in frontline and essential positions. And so thinking about role strain, and so I think I can talk a little bit about that in the Q&A, but the role of role strain as it relates to choices in terms of employment. In terms of the underlying motivation to continue working, the need to continue working, also for economics, but also what it means for fathers' sense of masculinity. And also thinking about shifting social support systems or the loss of social support systems. And thinking also about issues for non-residential fathers and mothers, right? So we're seeing the effects of not being able to see children routinely, how that is impacting broader family processes, family stress, for example. And then also to think about the broader health context of what work contexts, these work characteristics might mean indirectly for physical and mental health. And so quickly, I will several presentations have talked about this navigating dual pandemics. The introduction nicely laid out that African-American Black families, as well as other families of color, have experienced COVID-19 amidst ongoing acts of racism and racial trauma. And so what we have seen in much of our work is understanding not just how parents help their children cope, but also how they begin to cope and understand their own race-related traumas, and also awareness of structural inequities and what that means for their own self-care and how they operate within their broader family system. And so again, thinking about supports for families and leading into the discussion, or the next slide, is thinking about how fathers and mothers, other family members can help support children, and thinking about that with an advocacy, action, and/or resistance lens. And so thinking about, and I'll end with this is my last slide, around ways to support parents and children. And we'll follow up on many of these themes in our Q&A, but I wanted to leave you with thinking about many of these supports at a systems level with an equity lens. And as we talk about families, fathers, thinking about how we can better advocate, but also thinking about action and what this means for not just families who have fathers and mothers who are essential or frontline workers, but to think about how we can better support families in their unique needs. And as COVID-19 has continued to unfold, I have time and time again seen ideal models and less ideal models around strategic partnerships, and thinking about how we can better leverage and harness these strategic partnerships, both in terms of access and resource provision, but also thinking about ways that we can better support families, and thinking about fathers as thinking about their own mental health, their own health, and what it might mean for health at the family level. And that is regardless of whether the father lives inside or outside of the home. And also I want to leave you with just some quick, what I have been saying this time is that we cannot think of this as only a response to COVID-19. So as we continue to talk about supports, both throughout the remaining presentations, but also in our Q&A, I think this is an opportunity to address the immediate needs of families who are experiencing stress during COVID-19, but also if we are focused on sustainability and equity, we must begin to think about long-term solutions that alleviate some of these long-standing inequities, and really, hopefully, in that respect, alleviating some of the stresses that many families are facing in this context, but also pre and post. And so I will end, and the next presentation can begin.
Thank you so much, Dr. Cooper, for helping us get our heads around cascading effects, which I think is so important. We talk a lot about in this pandemic about the physical health implications. We don't talk about the shadow pandemics, right, that are emerging as a consequence of neglected socio-emotional supports for parents and families. And thank you for reminding us that this is an effort towards sustained action and commitment to helping parents cope and to do a better job at supporting their children during such a difficult time. Greatly, greatly appreciate it. I'm so pleased to have Mr. Anthony Gay be our final speaker before we move into the Q&A. I also want to thank everyone so far who has already put questions in the Q&A, and we will get to those very shortly. But welcome to the panel stage, Mr. Gay, and we look forward to your remarks. Thank you for being with us.
Thank you. Thank you so much. Once again, thank you. It's a pleasure to be here. And as I stated, to be amongst all of these esteemed panelists, this is certainly an honor for me. And I'm going to do something a little bit different in the sense that I'm not going to use a PowerPoint presentation. I will say that I don't want to be repetitive, and a lot of the things that I was planning to present were already presented, right? Which is a good thing for me, because that means great minds think alike. But so I'm going to sort of turn this into something a little more personal and sort of share what I'm doing as an individual to address the issues of unrest and to address the issues that I face within the agency in which I work for. And I do a lot of work related to fatherhood engagement. So our agency in Connecticut here at DCF, we've made a concerted effort to try to address or change our agency and become an anti-racist agency. So that is our goal, that is our theme, and that work has begun. And we have put a lot of energy and effort into that. With that being said, you know, you have your systematic sort of agency expectations, but then I have these expectations that I have of myself. As a man of color, living in America, seeing what's going on, as a father of a 5-year-old, dealing with the pandemic, dealing with COVID-19, dealing with all the unrest, how do I keep myself whole? And how do I keep those around me that I know in a place where they have some level of balance, right? So, you know, I wanted to share this with everyone, just sort of my situation and my scenario, some of the things that I've been able to do that sort of been able to keep me afloat. You know, I am a supervisor within the agency, and my wife is an office director. She has a staff of about 350 people, right? I'm a supervisor, so I don't manage as many people as she does. But with that being said, I have my own company called Welcome to Reality, LLC, and I also just started a nonprofit. And my LLC does work around social media and media literacy. And one of our esteemed panelists talked about stereotyping and imagery and what's being seen on TV and what's being perpetuated about men of color. And when a man of color is arrested or killed in front of our eyes, the first thing that the media does is try to dig up something about his past that's irrelevant to the moment that man lost his life, right? So we have to be very, very conscious about that and how that is impacting those around me and men around me. So what I did was I took my energy and I put some of that energy into my personal cause, and I was able to develop a particular training called Dear Black Male. And it's broken down into 4 components. It's broken down into the first component talks about the systemic racism since 1619, since the first 19 to 20 slaves were dropped off in Virginia, right? The second part of that training talks about the personal experiences that men of color, particularly men of color, face on a day-to-day basis in terms of systematic racism and oppression. The third portion of that talks about how the media, from the inception of media, has portrayed men of color. And that's very, very prevalent because that can shape the lens, that shapes the lens of how people see things. So when you think about people in positions of authority, if you don't have any friends who are black and brown, and all you see is what media tells you, and you're a judge or you're a teacher or you're someone in a position of power, when you make decisions based off the influences and the lens that you sort of see this world through. And the last piece of that, and I'm very, very grateful because I struggled pulling the last piece of my presentation together, but I was able to get information from Dr. Powell, who actually helped me sort of full out that entire presentation. And that last piece speaks to the fact that men, particularly men of color, struggle with therapy and going to therapy and saying that they need therapy and they need help, which goes back to the hypermasculinity and some of those other things. So I'm just going to park that there for a second. I sort of want to jump back, and I'm going to come back to that. I want to jump to my personal experience. So here I am. I have a 5-year-old son, and my wife and I struggle. What do? Do we send my son to school? Does he stay home? We opted to keep him home. That's the choice. That's the decision that I made. And I think it's the right choice. It's been a struggle, and I'm certain it's a struggle for many across the country. But my wife, within her capacity, does not have the time. So I am his teacher. I have become his teacher. So I am now, instead of getting up at 7 o'clock in the morning, I'm getting up at 5 o'clock in the morning. And I'm working 2 hours early on my stuff to be ready and prep for him at 7:30. And then I got to work 2 hours after I'm scheduled to be off the clock to finish up my stuff because I have to meet his needs. And it's a struggle to do it, but it's a sacrifice that I thought that I needed to make. The unfortunate piece in that is I'm not alone in that. And there were many, many men who were forced to deal with that. In my work capacity, here I am supervising cases, and fathers have to make the choice on whether they want to continue to work or opt for state assistance because they don't have a choice and they don't want their kids to be subjected to COVID-19, right? So then you talk about how that impacts their household and how that impacts relationships and all of these other things. And I just saw it happening over and over and over. So what I decided to do was use the platform of Dear Black Male to create another situation through my nonprofit called Chop It Up. So I have a group of men from across the country that get together every Wednesday night, and we spend 2 hours together. And it's not a support group, but we're there to support each other. And we talk about these issues. We talk about COVID-19. We talk about the pandemic. We talk about the unrest. We give each other tips and suggestions on things that they need to do to keep themselves whole and to walk away from that meeting feeling a little bit better about themselves. And the feedback has been phenomenal. Some of the tips that I've offered to individuals who participate in Chop It Up is I try to make my son's day as normal as possible. He goes to a charter school. They have a uniform. When he wakes up in the morning, he puts on his uniform. I have a desk. He sits at his desk. His hands are on his desk. His feet are under his desk. During his Zoom calls, he needs to be very, very attention focused on what's going on and not looking around. I mean, I try to make things as normal as possible for him. And I actually had my son do a COVID-19 video so he research COVID-19 so he can do a video to share with his classmates. So he would have a better understanding of what COVID-19 is and why there's limitations for him to go out and see his friends and see his TT and see his cousin and see all of these other people that he's used to interacting with. And I share this with the individuals that participate and Chop It Up on Wednesday nights. Now back to my job, and I know it seems like I'm all over the place, but this is a topic that's very near and dear to my heart. In the workplace, I just see men of color, fathers particularly, who just feel defeated and deflated. And that's what leads me to do what I do outside of it. Because when you work in a bureaucracy or agency like I do, you have these limitations where you just want to do more and you can't. And I felt it was incumbent upon me as a man of color, having some resources, having a particular skill set, and having some colleagues who could provide useful information. I took advantage of it. And I haven't asked. One of the things we do during Chop It Up is we reach out to individuals like panelists who are actually on here today. We have people in particular areas, people who talk about hypermasculinity, people who talk about racism, systematic oppression, and we have them come in and speak for 10 to 15 minutes on a particular topic to educate these men on how to overcome the issues they're dealing with on a day-to-day basis. We have people from school systems, superintendents, come in and talk about things that they can do to make sure their children are achieving their educational goals as they would like to. And one particular gentleman last night on Chop It Up said, me and my wife, we're having a really big conflict. And because my son does well being homeschooled, but my daughter excels when she's in school. And my wife is saying, either they both go or they both stay home. So we spent 40 minutes on Chop It Up trying to figure out a strategy for him to try to convince his wife to have the kids do what's best for them. Because I think from the educational standpoint, we should be doing what's best for our kids. I could go on and on and on about this. I know we have to get to the Q&A, and I don't want to take up all of this time. And I appreciate the moment and the seconds and the minutes that I was given. And I hope you all got something out of what I was able to share with you all. So thank you.
Thank you so much, Anthony. And of course we did. I mean, one of the things that's important about this work with parents is that we do nothing about parents without them. And particularly when we talk about Black fathers, we often are talking about them from the balcony, and we rarely invite them to center themselves at the table, and we rarely amplify their voices. So the stories you share, your experience at DCF, the groups that you're creating for fathers and parents are so important to hear about. We did have one question, and since you are on the mic, I want to ask you this. Someone asked for the name of the group that Dear Black Men, was it, that you mentioned? Can you clarify that for the audience?
So it's Dear Black Male.
Dear
The
Black
name
Male.
of the training is Dear Black Male.
Okay.
It's posted on my website.
We'll type that for folks in the Q&A box and the chat box, so folks can have direct access to that information. Thank you so much. Thank you all for staying with us. We have some moments left, and we have a good amount of time here to answer some questions. So I'm going to jump right in and start with ones that are in our Q&A box. There have been a lot of questions in the box about tips to help parents adjust to virtual learning, both parents who are co-parenting with a partner and folks who are parenting as a solo parent. So I'm going to start with Dr. Williams. If you could provide some tips from your perspective about what working parents can do to adjust to help their children with virtual learning, and speak to any of those configurations, you know, as solo parents, as dual parents, as single sex parents, any bit of information or tips you could provide, we would appreciate.
Absolutely, and I just want to thank Mr. Gay again for sharing some of the details of his specific context and what was happening with friends and colleagues as well, because it is in the nitty-gritty, and everyone's situation is sort of the same, but not. One, because your child is different, and two children in one family can be entirely different. And it is a luxury. So what I'm about to say is me with best practices and what I think I would want to do and see happen for my nieces and nephews and godchildren, is that you want to have something that's very specific and that's catered to who that little one is as a learner and a human, who they are as a human and a learner. And you do know that, you've known that all their lives, but especially as they've been at home, you know that. And then at the same time, be realistic about what you actually have in your capacity to deliver on a regular basis. Again, I would piggyback on what Mr. Gay shared, that the young people, the children, the students, they need regularity, and they need some level of systemic, regular structure, whatever it is. And at the same time, that level of structure and regularity hasn't worked for everyone all the time. And in fact, some kids are doing really, really great because they're not in school. And that regularity and that structure, sometimes the overstructure that we can see happen in some schools, has been really problematic for them. And so this is a really great opportunity. And I try to frame this inside of the opportunity that it is for parents. I would say too, that parents need to figure out what their schedule is with their kids. And some parents, whether you're home with a partner and your children, or you're home on your own with your kids, or you have to leave because you're an essential worker and you're putting your care of your kids with someone else during the day, being very clear about what the expectations are in that schedule. And I would say, please don't be shy about being a bit dogmatic about that, because the children really do need to know that they can depend on the regularity of whatever it is going to be. Kids have really enjoyed reconnecting with their classmates, even though it's online, because they miss them, and social emotionally, they need to engage with people their age. They miss their teachers. The mental health of their teachers has also been compromised because their teachers love them and they miss them too. And so having these spaces and ways in which that can happen is really important. I would say though, that we all haven't gotten the memo around the fact that this much screen time all day is not good for any of us, and really be thoughtful about the types of learning capabilities that your child has, as well as the limitations they will have around attention and what could happen to their learning and attention restores and capacities with this type of learning, right? Like, this is not a normal situation. I think Dr. Hollister mentioned that in his slides, you know, this is not normal. It's not normal. So while we typically send children to school for 4 to 6 hours a day, not now, we don't do that. And we have to think about other ways of breaking that up. I would say I'm just going to respond to 2 other questions that I saw in the Q&A since I'm here, and then I'll be quiet. With teenagers and mental health and depression and anxiety, you need to get them outside. There's not a whole lot that they can do, but what we do know is so incredibly important, and it's for kids and it's for us, is that we need to move. We need fresh air. I'm in Northern California right now. Fresh air is not something you can take for granted, but when the air quality is good and you can get out and take that walk, take walks with them. This is a great time to be talking to them. You need to be talking to them in as much as you can. And the last thing to think about with coaches and all those other adults who are sort of in the educational, social, emotional ecosystems of your kids, they all miss your kids and your kids miss them, and they miss the socializing and the group experiences they were able to have there. It may not be safe, depending on where you are, to get together and have the group experiences around soccer or things like that. And then again, maybe it is if the kids put on gloves and wear a mask and they're just kicking the ball. Maybe that's just fine for a little bit. But what we do know is that running around, having engagement, laughing, being social, having moments when that can happen regularly, not every day, not all the time, but once a week, it gives everybody something to look forward to, including parents.
Thank you so much for those robust responses, Dr. Williams. You really did help us clear up a lot of questions in the Q&A, so we really appreciate it. And I'm sure our audience does too. I want to ask Dr. Singley, there's a question, and it kind of dovetails with a couple of questions in the Q&A about fathers who are, now co-parenting from a distance and fighting to be in their children's lives and facing challenges even now with being involved, even in the midst of COVID-19. We often don't talk about father rights and the opportunities that they have to engage and what we can do to support them. And I know you do this work most predominantly in your work with fathers. So can you speak to those issues?
So is the question how to be involved?
What advice would you give to fathers to increase their sense of advocacy and agency and being involved? And then, any other practical suggestions would be appreciated.
Well, it starts with everybody, just to have the realization that involving the fathers, even when we're talking about newborns, infants, babies, toddlers, it's super important to have them involved. There's scads of research support, the developmental outcomes for the children themselves, but also for the dads themselves and their mental health. And so just one key point is don't let that be a blind spot. Like don't assume like, oh, it's COVID. COVID throws up yet another series of barriers that will make it harder, significantly harder for folks that have financial disadvantages, who are experiencing other kinds of barriers. Like top level, just recognize they're important. Second is for the dads that kind of need to hear it. One of the ways I like to frame this is we talk about, if you ask your average dad who's becoming a dad, like, what do you think it means to be a father? They'll tell you protect and provide, right? Like that's fairly foundational in certain ways. There's a lot more to it, but I like to meet men, fathers, where they're at and say, okay, so check this out. Lots of research supports this point. If you provide the healthiest version of yourself directly to your baby and to your partner, if that's what the family constellation allows, you're actually providing something far more important once you get beyond providing for basic needs. And I'll use this. I really like what Anthony had to say about dads and mental health, because they'll push back and be like, no, I can't take the time for me. Like I got to be there for them. I got to be there for them. And I always say, cool, like be there for them, but that's the strength that you're taking too far, so that you're not going to be able to provide the healthiest and best version of yourself. If you need to go talk to somebody, a friend, a colleague, somebody in your religious community, like it doesn't have to be a shrink. Like I'm happy to talk to you, but do what you need to do to get that healthiest version of yourself that you can, and then try to be with them as much as possible. And for us to realize that paternal involvement is a lot more than just kicking a ball. Like that's not what you do with an infant. It's being around, it's providing a presence, and it really starts with trying to have as good of a relationship with the mom or with the gestational parent as you possibly can. Like that's something that you are doing for that child. So I'll shut up now, but believe me, I can keep going on that one.
No, that's really, really important. And I think that providing that level of insight to parents about what they can do actively helps to remove that sense of complexity around the process, but also I think fathers and mothers who are in those kinds of arrangements feel stuck sometimes and not really knowing how to move forward. And you've really helped. I want to pivot a bit, because there was a question here, Dr. Cooper, that I think you could answer. I could probably add something, but I'd love to hear your point of view on this. Because of your role as a developmental psychologist, someone asked, what are some of the ways that the transmission of intergenerational trauma affect the well-being and development of children? I know you have lots of experience in this space, so I just want to give you an opportunity to respond. Thank you.
So I will try, this is a complex answer to a very complex question, but, I think it's, what I often say is that parents in the moment find out how complex those traumas are as they, as they're parenting. And so some of those, a lot of the work I've done is focused on families of color, and some of those are racial traumas, but some of them also are around their own experiences with their own parents. And so, those have been, very real issues as fathers make sense of their role as fathers. And so some of that is both rooted in the father that they have, and so making sense of that in the context of their own fatherhood. And so those are some ways. I often say is that people will, there are a couple pathways, there's actually several pathways, but, kids will often say, I want to be like my parent if I can. They're a great parent. Or when I'm a parent, I don't want to do anything like my parent, or I want to be this kind of parent. However they situate themselves is that context has shaped how they see their role as parents. And so thinking about that in a trauma, with the trauma lens, is that there are various ways in terms of how parents make sense of themselves, their efficacy around parenting. We see a lot of fathers who say, I'm not sure how to be a father, or I don't know if I'm doing this right. And so those are just, that's just a couple of ways that we see it impact their parenting. A lot of sort of the stress, the work stress, we see that come out in terms of just their level of patience. And so some of our fathers, so a lot of my work is with fathers who have older kids. And so we often talk about that there are resources, relatively so resources for fathers with younger children, but as children are older and need very specific things, sometimes our fathers will say is that, I don't necessarily know who to ask, or they're wearing my patience thin. How do I increase my level of patience? And so sometimes those are the sort of pathways that we see some of those stresses, those intergenerational traumas sort of work its way into sort of the familial fabric.
Thank you so much, Dr. Cooper. So important. We know that intergenerational trauma manifests in so many ways: relationship conflicts, physiological disruption. For example, we know that when people experience trauma, they can have alterations in their genetic blueprint. They can have decreased capacity to fight illness, and more risk for behavioral and mental health issues, as we've been discussing. So lots of things to keep our eyes out for. But Shauna, you really made us think about how this shows up in the parent and how that gets transmitted through their behavior and interactions. Very important. Dr. Hollister, there have been some questions in the chat about how parents can, sort of make decisions about their work-life balance in the midst of the pandemic. One of our guests asked, if you're a working parent, a faculty, for example, as many of us are, and you're thinking about, because of all the stress, stepping out of the workforce to care for your young children while the schools are closed. I mean, most parents' backs are against the wall. They're, on webinars and Zoom, and then they're moving to, take care and feed their children and make sure they've gotten their lessons. One in the chat said they're struggling, with their professional identity versus their role as a mom. What advice would you have for parents who are in that situation?
Boy, it's a really rough thing. And I think the first thing is to realize you're not going to do it perfect. This is one of those situations where you just hope that you're good enough, but you're never going to be perfect. As soon as you think you need to be perfect, you've lost the battle. There's just too much ground to cover right now. What I do think, Dr. Williams was speaking before about the importance of routine and a schedule. Keeping kids on a schedule so that they know what's going to happen first. Kids don't need you necessarily to be there just every second of every minute of every hour. What they need is for you to be dependable. And part of the way that you're able to be dependable is to create a schedule and a structure that they can depend on, that they understand. Anthony was talking before about how he set up a kind of a school room in a sense, and that was different than home life in a way. That was the moment where we're going to do school. And there's a little more, when you're doing that, you're not the child's friend necessarily, you're their instructor. There's a little more distance there than what would be the case. And so I think the thing is to recognize you can't be perfect about it, but make sure that you're dependable, make sure that you have a structure, make sure that there's a routine, make sure that, as Dr. Williams was saying, you get kids outside and you get them some exercise so they have a way of releasing their tension. Because they're just not going to release their tension all the time in words. And if they are, you're probably not going to like the words sometimes. So find ways to make your small world as normal as possible, but understand you're just trying to do it so that it's good enough, so that it's not going to be perfect. Is that a little bit in the what you're looking for, Dr. Powell?
First of all, phenomenal response. Absolutely. You touched so many pointers and you've given our viewers so many practical ways that they can normalize what is absolutely not a normal situation that we're all living through. I do want to, honor the time that we've been together. It's now almost at 6 o'clock when we're supposed to end. There are lots of questions remaining in the chat. I will just let's do some rapid fire responses. Someone in the chat asked about what can parents do now to deal with the multiple stressors of being in a sandwich generation. And I think this is a question that comes up a lot. People are caring for their parents, their children, and now having to care for themselves. Many of us have had loved ones who have been affected by COVID-19, and that disrupts all the family ways that people function. And so I think that the most important thing I would say is that you have to care for yourself. And I'm not saying that this is more important than caring for your family or loved ones, but the adage, if you put on your oxygen mask first before you help others, I think as parents, we have to give ourselves permission to actually take care of ourselves so that we can be there for the people who need us most, our children and our parents who are on the other side of that sandwich. I also want to, end with just a couple of thoughts about resources or sort of instructions about resources that we'll provide. This video will be made available online, both at the Division 51's website, at the UConn Health Disparities Institute site, and also an APA site. So at that time, we will also post some resources folks were asking about in the chat. What are resources people can avail themselves of to help support them through this time? I also want to acknowledge all the teachers and educators who are in the Q&A asking about what we can do to support teachers during this time. I think that's also really important for us to keep top of mind. We will also try to drop some resources on the posted video site. But to end our conversation, I think I would be remiss without asking this question from everyone, and I'll do a rapid fire round robin on a really tough question. So let me just say that up front. Many parents are asking about the bearing virtual witness to racialized violence and the distrust that children are feeling around police and how that's raising their anxiety. I'm wondering if you could all offer at least one or two words of advice, hopefully one, to parents who are watching, teachers who are watching, co-parents, social fathers and parents and mothers. What can they do to support children during this particular time with those kinds of unique anxieties? I'm going to start this off with Mr. Gay. Why don't you weigh in here first?
So I would say briefly, I think it's just really talking to them, doing a check-in, seeing where they are, gauging where they are, talking to them at a level in which they can understand, and just really reassuring them that you're there for them if they need to discuss or talk about issues, and that they should talk to you about the issues and what they're feeling and not hold it in and get information from somebody who may not provide them the right way to go, who might send them in the wrong direction. As parents, we would hope that our kids will come to us and be able to know that we give them information that's going to help them sort of survive in these times. Because I've had to have some of those conversations and they've been very, very tough, but necessary.
Yeah, and I think, thank you so much, Anthony. I think it's also important for us to recognize that the responses we're giving now, what we're focusing in on Black, Indigenous, and children who come from communities of color. We're not suggesting that these sets of advice or resources won't work for all children, because actually all of our children are bearing witness to this violence and have questions about equity, about justice and fairness, and may also be experiencing some of these anxieties. Dr. Cooper, what would you add to the conversation?
So I would say something similar is that, talk to your kids in ways that are developmentally appropriate, and that, give them a space. So Anthony mentioned doing check-ins, and sometimes it doesn't mean a long conversation where you're hashing out all the nuances and specifics, but sometimes kids just had to have someone listen or to work through some of the thoughts that they're having around some of the issues. And so I would say is, whatever your child is willing to give, be ready to respond. I also tell parents, and sometimes this is where it's harder for them, but sometimes being silent around it and sort of not talking about it can really exacerbate things. And so however challenging it is for parents, I think it's an opportunity to, allow children to have a space, and also to channel it. So to go to a protest or to, make up a petition, whatever will help that child feel that they have a voice and that they can create change in their space in the world.
Thank you so much, Dr. Cooper. Dr. Hollister.
Oh, I think, kind of like what Anthony was saying, being a good listener is just absolutely critical. And I think everybody kind of supports that idea. And so much of it, kind of like Dr. Cooper was saying, is age dependent. The only piece I'm going to add is that I do think that in this day and age, you need to be coached on how to handle authority figures. Because I think that a lot of kids get themselves into situations where they get into conflicts that they don't need and don't want, and you don't want for them. And so I think walking them through what I think is almost a crisis situation is pretty valuable in this day and age.
Thank you for that, Dr. Hollister. I really love that advice. And I also want to, and I know Dr. Williams may speak to this, want to talk a little, add just that even when we give children that talk about sort of responding to authority, that there are sometimes that doesn't even save them, so to speak. So we have a saying sometimes in my community, that respectability doesn't always save our children. And yet at the same time, what you offer, Dr. Hollister, is an affirmation that parents who are giving their children that advice are doing the best they can as parents, and are doing the right thing by preparing their children to go out into a world to create more equity, justice, and unity. So I appreciate that very much. Dr. Williams,
You're really correct in saying how hard it is right now.
Yeah.
That's really true. I appreciate it.
It's a challenge, yeah, but I also appreciate the practical ways in which we're trying to support parents. Dr. Williams, you have the final word on this topic before I close out.
I would say I agree with everything that's been said, and I would just add for us to not underestimate how important it is to hold our children and help them to feel safe, and remind them that there are still good people, that everyone is not out to get them, and that they are loved, and that there are people who will protect them and who hold them in high regard. Because that is the message that needs, I think, to be reiterated over and over again right now. It feels very scary when we have all the noise and not this counter narrative or counter messaging.
Absolutely. Well, I want to invite you all to do as we've been trying to do at Division 51, to hold space for our children, and to really speak lovingly and warmly and passionately to their wounds. Optimizing the well-being of our children during this time should be the most critical thing that we're focused on, because if one thing is clear, future generations will condemn us for not holding space for our children, who are our most precious resource. I want to thank all of the parents that are here and affirm the work that you're doing in this really difficult time to take care of yourselves, your children, and your communities. We're so grateful that you're here today. We hope that you continue to stay with us, follow along as we continue these conversations during the pandemic, but more importantly, stay in touch with one another, support one another. Thank you for being with us. Have a wonderful rest of your evening. And thank you to my panelists for giving so much wisdom to our audience today. Take good care, everybody.